future nurses, in our first year, we have been exposed to different theories. These theories will serve as a guide on our journey to become successful nurses one day. We will be discussing about Joyce Fitzpatrick's theory, which is life perspective rhythm model. These are the contents of this presentation. Joyce Fitzpatrick life, her works, books, and lastly, the theory. This is Dr. Joyce Fitzpatrick, RN, PhD, MBA, and FAAN. Life. Who is Joyce Fitzpatrick? Dr. Joyce Fitzpatrick was born in 1944. She is a registered nurse, Doctor of Philosophy of Nursing, a member of FAAN, a theorist, a professor, a writer, and a geriatric leader. Fitzpatrick earned her Bachelor of Science in Nursing from Georgetown University in 1961. Georgetown University is a private university in Washington, D.C., United States. Fitzpatrick earned her Doctor of Philosophy degree in nursing from New York University. New York University is a private research university based on New York City. She earned her MBA or Master of Business Administration degree in Western Reserve University. Case Western Reserve University is a private university in Cleveland, Ohio. She received a FAAN certification in 1981. FAAN, or Fellows of the American Academy of Nursing, are nursing leaders in education, management, practice, and research who have achieved success in professional nursing. Fitzpatrick is presently a professor at Elizabeth Brooks Board of Nursing, Francis Payne Bolton School of Nursing, and Case Western Reserve University. She was also the Dean of the FPB, or Francis Payne Bolton School of Nursing, from 1982 through 1997. She is a pioneer in nursing education, leadership, and research, whose work is well known across 5 continents. Works. What are her contributions in the field of nursing and nursing education? Fitzpatrick is also one of the persons who contributed in making the Florence Seller and Dodd Chair in Gerontologic Nursing, the first gerontologic chair in the world. She also provided consultation on nursing education and research throughout the world. She conceptualized supportive home care for coronary artery bypass graft patients, health of grandmother caregiving, teaching the use of resources for chronically ill older adults, effects of stress, and a caregiver's health. Fitzpatrick's abilities and numerous contributions to the advancement of nursing science and practice are legendary. Her leadership has brought substantial research, resources, and recognition to these specialties. Books. Who is Fitzpatrick as a writer? What are her written books? Fitzpatrick is also considered as a writer because of the published books she wrote about nursing. Some of the books are Encyclopedia of Nursing Research, 4th edition, Nursing Leadership from the Outside In, Conceptual Models of Nursing, Analysis and Application, Encyclopedia of Nursing Research, 3rd edition. Theory. What does her theory means? Why is it important to know her theory? Fitzpatrick's approach to taxonomy in nursing has been considered a primary basis for the development of the substantive structure of the discipline. The theory started out as an effort to develop a language that would define the clinical judgments made by nurses. It evolved into a broader range of categories, including the coordination of dataset for health statistics, the development of computerized patient records, and advanced education research. Background of the theory. Fitzpatrick conceptualized her model from Marty Rogers' theory of unitary human beings, which correlates of human development as the basis for differentiation, organizing, and ordering life's reality. Rogers correlates of shorter, higher frequency waves that manifest shorter rhythms and approach as seemingly continuous patterns serve as Fitzpatrick's posse for hypothesizing the existence of rhythmic patterns. Fitzpatrick also questions the physical laws to explain the evolution of life. She also capitalizes on knowledge from other disciplines such as anthropology, sociology, astronomy, religion, philosophy, history, and mythology. About the theory. The theory is a developmental model that proposes that the process of human development is characterized by rhythms. A person is treated as an open, holistic, rhythmic system that can be described by temporal motion, consciousness, and perceptual patterns. These are the major assumptions in life perspective rhythm model theory. Assumption 1. The process of human development is characterized by rhythms that occur within the context of continuous person-environment interaction. Assumption 2. Nursing activity focuses on enhancing the developmental process toward health. Assumption 3. A central concern of nursing science and the nursing profession is the meaning attributed to life as the basic understanding of human existence. Assumption 4. The identification and labeling of concepts allows for recognition and communication with others. and the rules for combining those concepts permits thoughts to be shared through language. The theory is a complex nursing model which contributed to nursing knowledge by providing taxonomy for identifying and labeling nursing concepts to allow for their universal recognition and communication with others. According to Fitzpatrick, the identification and labeling of concepts allows for recognition and communication with others. Four content concepts that comprise her theory are person, health, wellness, illness, and meta-paradigm. These are the four concepts of Joyce Fitzpatrick's life perspective meta model theory. Person. A term that integrates the concepts of both self and others and recognizes individuals as having unique biological, psychological, emotional, social, cultural, and spiritual attitudes. Health. A dynamic state of being that results from the interaction of person and the environment. Wellness, illness. A promotion of wellness practices, the attentive treatment of those who are acutely or chronically ill or dying, and restorative care of people during convalescence and rehabilitation. Meta-paradigm. It refers to the transitions through basic meta-paradigm concepts of person, environment, health, and nursing. Nursing. A developing discipline whose central concern is the meaning attached to life. Primary purpose of nursing is the promotion and maintenance of an optimal level of wellness.